The advice was clear: protect the NHS, free up beds in hospitals, discharge patients and prepare for the worst. But at what cost?
Blow me a kiss.
For care home residents and their families, it costs dear. Deaths behind closed doors while loved ones looked on.
It's heart-wrenching.
Jean's father caught COVID in his residential home and died. She could only watch from outside the window.
The most vulnerable members of our society were just literally thrown to the wolves, you know, lambs to the slaughter, without any care or regard for their lives.
Today, judges ruled ministers failed to consider the risk to residents from asymptomatic transmission. Matt Hancock claimed he wasn't told of that risk, but evidence of asymptomatic spread began to emerge in January 2020, and on the 4th of February, government advisers wrote, asymptomatic transmission cannot be ruled out and transmission from mildly symptomatic individuals is likely. The chief scientific advisor even told us the same thing.
We think asymptomatic people can be infectious. We're not really sure how infectious they are yet.
Other scientists studying the data at the time say it was clear COVID was being spread without symptoms.
By the end of February, there was pretty good evidence that asymptomatic or pre-symptomatic transmission was occurring. Discussions of asymptomatic transmission were in the notes of SAGE meetings, so it would have been known by people attending.
Looking back, one advisor to the government says the lesson it should learn is to always be ultra cautious.
I don't think we have been doing that enough in relation to the response to the pandemic. And I think we have to be aware that in times of high uncertainty, being cautious, especially when there's a very high risk of a bad outcome, is very important.
The outcome was bad for too many people, and today's ruling won't bring back Jean's dad, but she hopes it might mean it won't ever happen again. Emily Morgan, News at 10.